What are molecular diagnostic tests for TB? Molecular diagnostic tests for tuberculosis are advanced laboratory methods that help detect the genetic material of the Mycobacterium tuberculosis bacteria directly from patient samples. These samples can include sputum or respiratory specimens. The tests primarily use nucleic acid amplification techniques, with polymerase chain reaction being the most common. This allows for rapid identification of the bacteria and can also detect genetic mutations that indicate resistance to key anti-TB drugs, such as rifampin. One of the main advantages of these tests is their speed. Traditional culture methods for tuberculosis can take several weeks to yield results. In contrast, molecular tests can provide results in just a few hours to a couple of days. This quick turnaround is crucial for confirming active TB infections and starting treatment promptly. A key type of molecular diagnostic test is the nucleic acid amplification test. These tests amplify specific DNA or RNA sequences that are unique to the Mycobacterium tuberculosis bacteria. One widely used test is the Cepheid Expert MTB-RIF assay. This test not only detects the presence of the bacteria but also identifies mutations in the RPUB gene, which are linked to resistance against rifampin. Results from this test are typically available within 2 hours. Molecular tests also excel in detecting drug resistance. By identifying genetic mutations that confer resistance to first-line drugs, healthcare providers can tailor treatment plans without waiting for the slower culture-based drug susceptibility testing. This is especially important in managing multi-drug-resistant tuberculosis cases. The sensitivity and specificity of molecular tests are high, particularly in samples that test positive for bacteria. They are recommended by the World Health Organization as initial diagnostic tools for pulmonary tuberculosis. While these tests are primarily used on respiratory specimens, there is ongoing research to develop molecular diagnostics for non-respiratory samples to diagnose extrapulmonary tuberculosis. Another advanced method is whole genome sequencing. This technique provides detailed information about the strain type of the Mycobacterium tuberculosis bacteria and any resistance mutations. However, due to its complexity and cost, it is less commonly used in routine diagnostics. In the context of confirming active tuberculosis, molecular diagnostic tests complement traditional methods like sputum smear microscopy and culture. They provide rapid bacteriological confirmation, which is essential for initiating effective treatment and controlling the spread of the disease. These tests also play a vital role in identifying multi-drug-resistant tuberculosis cases early on. Overall, molecular diagnostic tests representing a significant advancement in tuberculosis diagnosis. They improve the speed and accuracy of detecting active tuberculosis and drug resistance, ultimately enhancing patient care and public health outcomes. It is important to interpret results alongside clinical evaluations and other laboratory findings, and testing should always align with established guidelines from health authorities. For personalized medical advice, consulting healthcare professionals is always recommended.